First of all, thank you for the interview. I will present some of my research on immunotherapy in prostate cancer, and some of the latest news from clinical trials that have been presented in international meetings. So what is emerging now, I mean, it's something that we already knew, but more than one trial is pointing in the same direction, is that immunotherapy on its own, so we are talking about primarily about anti-PD-L1 or anti-PD-1 on its own, or in combination with other standard of care for prostate cancer, for metastatic castration-resistant prostate cancer. That could be androgen receptor signaling inhibitors like enzalutamide, or even PARP inhibitors that now have got indication for metastatic prostate cancer with specific alteration. Do not work in every patient if they are unselected. So some of my work has been published in 2018, in 2020, points actually in the opposite direction. So there is a chance that immunotherapy, and specifically anti-PD-1 or anti-PD-L1, might work with in prostate cancer, metastatic castration-resistant prostate cancer, with specific alteration, and more precisely alteration in a specific mechanism of DNA repair called mismatch repair. So this is true in other tumor type, it's true in colon cancer, and the FDA a few years ago gave approval for any kind of cancer with mismatch repair alteration or microsatellite instability, but nobody so far has proved in a clinical trial that this is true for prostate cancer patients. So now there are few ongoing trials. One is a big UK national trial that I have designed with Professor De Bono while I used to work at the Marsden Hospital. Now I'm in Newcastle University, so I'm still in UK, but different location. So a few years ago, with Professor De Bono, we designed this clinical trial testing pembrolizumab in patients with mismatch repair alteration and some other specific alteration. The trial is not finished yet, so I can't give you any update about that. But definitely what I can tell you is that there are evidence now that what is true for colon cancer patients is true also for prostate cancer patients with advanced disease. And we have published a few years ago few cases of responders to immunotherapy, and some of these cases were mismatch repair patients, and this patient, mismatch repair deficient patient, and this patient had pembrolizumab a few years ago. We are talking about 2016 or 17, and had such a good response to treatment that their disease completely dissolved, so disappeared, and they've been disease-free since 2017. So we are talking about absence of metastatic disease for 6 years. That is something that doesn't happen quite often in prostate cancer. The problem is that these alterations are quite rare. So I would say that approximately 5% of the overall population of metastatic prostate cancer patients harbor this alteration in mismatch repair. It could be even less. And the problem is that it's what I call a condition that is necessary but not sufficient to give 100% response to immunotherapy. So there are still some patients with mismatch repair deficient cancer that do not respond to immunotherapy, and we don't know right now why this is happening. So this will be part of my presentation for sure. I'm also thinking to present some slides a bit outside the PD-1, PD-L1 ligands and the drugs that are involved in this pathway. There are now evidence that there are immune cells fueling prostate cancer as well. some of these cells are called myeloid derived suppressor cells, so MDSCs, and that could be another target for immunotherapy if you want. So it's what we call immunomodulation, so trying to modulate the presence of other of immune cells around the cancer. But we also have evidence now, and that's, if you want, is part of immunotherapy as well, that also the gut microbiome could be potentially important in the prostate cancer development, or at least in the development of what we call castration-resistant status. And that's a work that we Professor Devon and Professor Andrea Limonti, that works in Bellinzona, Switzerland, we have done all together. There are basically some gut bacteria that are able to produce really small doses, of testosterone. So that could be another source of testosterone that then goes into our system that can be used by cancer cells. So another idea would be the immunomodulation of our gut microbiome, of our patient's gut microbiome, in order to use it as a vulnerability and potentially as a treatment for prostate cancer as well. So we now have the proof that this is something that could be relevant in our patient. We still don't have the proof that this is, a possible treatment, by something that is worth it to investigate. The data that have been presented on big, there was a presentation on a big clinical trial of immunotherapy and hormonal treatment, and again, it was in an unselected patient, and there was no clinical benefit from the use of immunotherapy in unselected prostate cancer.